Well, welcome. I'm Dr. Brett Titensir. I'm excited to bring you another case bite where I demonstrate the power of digital dentistry and how you can use it to place a single full coverage crown, zirconia crown, in 1 hour, and the advantages that brings to your practice, to your patient. Brief introduction of myself. Been working with Henry Schein for some time now. I can't thank them enough for this opportunity to bring you this case bite, and also the partnership we've had in my practice. They helped me be the practice I am today. I practice in a town just north of the DFW airport, a town called Flower Mound, Texas. We have kind of built everything around digital dentistry. There's nothing we don't have. You will not see alginate impressions in this office. We have 2 intraoral scanners. We have a cone beam CT. In-house manufacturing, which is going to be highlighted today in today's case bite, has completely been a game changer. Patients love same-day dentistry. We get patients coming in all the time just because they have heard from either our ads or our website that we make our crowns in office. They know it's available. They want it. People do not like making multiple appointments to have to come back. They do not like temporary crowns that break or come off. The ability to place a final restoration in one appointment will transform your practice more than anything. A few years ago, I started to think about, okay, what is this 1 hour crown? What would that do? I place implants. I do veneer cases. Those are kind of the hot topics. They're highly productive. But if you can get a crown seated in 1 hour, I argue that it rivals production per hour of implants and veneers, if not more, and without the added risks. There's very little lab costs. This is a procedure that's just done. They walk out of here with their permanent restoration. You're not dealing with nerves that you could possibly hit with an implant and all the other risks that are involved. And so, I've always heard it was possible to do a 1 hour CEREC crown. And so I wanted to take on that challenge. And so what I ended up doing, I found a willing patient. And so here's Sarah. And I brought my workout timer from home and I put myself on the clock. We wanted to not only see if it was possible, but make sure that nobody, second guess stuff if we actually did it. So we filmed it from start to finish. We put an hour on the clock to see if we could get a fully seated crown in an hour. And teaser, fast forward, here it is. She is getting out of the chair. The crown has been cemented, final x-ray taken, and you can see there's 59 seconds. Yes, I'm taking off her bib. I really wanted to get her out of there to make sure we got it under an hour. And sure enough, we did. So just here in the next few minutes I have with you, I just want to go over some tips and tricks on how you too can place a crown in an hour. So if I broke down the time, I went back over the video and I broke down what all of my times. You can see right here to prepare while they're numbing. That's a crucial time that you can use, whether you're scanning the patient, you're preparing the block in the middle. The time where you could see, I would recommend slow down is preparing the tooth. You want a really nice prep of the tooth to get a nice restoration. The technology's got to the point where this CEREC design, the crown design on the actual computer is AI driven. It's easy. You get really nice proposals. And so you should not be spending a lot of time on the machine itself trying to design a crown. And then from start to finish to process with the prime mill to process a zirconia crown, it takes about 30 minutes from start to finish. And these fit so nice that your seat is 5 minutes or less. So here's a breakdown. All right, for those first 3 minutes, you get that blood pressure anesthesia. I use a really good numbing gel. Can't emphasize that enough. People don't like to go to dentists that hurt them. During that time, you want to use that while they're numbing to get intraoral scans already. This is all of my assistants are doing this. They take the shade. Here is the intraoral photo they take. We take intraoral photos with the prime scan for every case. That way we can use that and send that to insurance. We can use that for our own database. So you can see here, we're doing tooth number 19. It had a root canal, and we're going to give her a full coverage crown to protect that tooth. You know, there are some things that can help. The tooth preparation, which is the next 15 minutes of the hour. Make sure you're getting enough occlusal clearance. Now, here's a part number from Henry Schein. I really love these depth burrs. It ensures that you get enough occlusal clearance. For instance, probably the most common mistake, most common reason for fracture is not having enough occlusal clearance. Make sure you're doing the 2 plane axial reduction, nice rounded cusps. You don't want what's called over milling when you're doing in lab. When you're doing milling, you can see some over milling if you leave those cusps sharp. So make sure you round those. In the end, after I've placed my cord, I always like to go back over the margins with a nice red stripe diamond burr. You want really smooth, very apparent margins, so that way that crown will seat and fit perfectly. I do the 2 cord technique. I place a 00 cord. I do the red stripe burr, refining my margins, and then I go back over that with a size 1 cord. And after that's been in there for about a minute, I pull the top cord and we scan it immediately after that. You can use things like diode lasers. If they're having bleeding, I like to use this lidocaine with a higher concentration of epinephrine. There's different ways. You've got to get good gingival retraction. So here's an example, right? So here's that top cord placed. Upon removal, this is what you should see. You should see really nice, crisp, well-defined margins. So that way you can ensure that restoration will seat and fit perfect. So your prep scan, all right? My assistants have already scanned the upper, the opposing, the bite, the lower. What they do is they just cut out the prep. So after I've prepared the tooth, place the cord, they pull the top cord, I am scanning that final prep. So kind of like your final impression. I always like to position myself where I can see both the patient and the screen, so I can ensure that I am capturing what I need. This should be quick. You see in my video, it took me less than 1 minute to get this scan. All right, design. Okay, on a case bite situation, we only have a few minutes. I can't necessarily demo it, but next time you get your hands on today's technology, you'll see that designing these crowns, the technology has gotten so good that you shouldn't have to spend a whole lot of time designing to get a nice, perfect crown. Practice makes perfect, but definitely that should not be something that keeps someone away from diving into digital dentistry anymore. Very user-friendly, something that anybody can pick up and do. All right, so we have the prime mill, and so we're able to super fast mill our zirconia. This mills, you can see the milling process took less than 6 minutes to mill out tooth number 19. So it's done really quick with the prime mill. I do recommend have a good organization system. We have a cabinet right here. This prime mill sits right in my hallway. I love showing off this technology. Patients love seeing it. I always have them come watch their crown being made. It's fun. They even pull out their cell phones sometimes, take a video, post it on social media, right? Show it off. All right, so after it comes out of the mill, I use something like this, a fine carbide to remove the sprue. And I also carve in a little additional anatomy to make sure these look nice. I still like it to look lab quality. And so if you take just a minute or two to carve in some anatomy, make sure this is contoured like a natural tooth, it really goes a long way. But 3 minutes or less, and then you get it into the Speedfire oven. All right. If you're using the Speedfire and Zirconia, make sure those margins are up. This usually takes about 20 minutes, somewhere in the 19-minute range. And this is a great time to either be going down to hygiene to do your exams. You could be back in the room. A lot of times I'll be doing an additional filling on the patient while the crown is in the oven. So you can use that time wisely while that crown is being sintered. It comes out of the oven, and I like to do a nice polish so that way it feels really smooth to their tongue. I go through a course of medium and fine, that this is something that should take only a few minutes from start to finish, and you get a really nice high shine on these crowns. I try it in. I check the interproximal context, make sure it seats all the way. I look visibly that it's seated. I then you can clean it out with Ivoclean before you use something like this, the Calibra, which is a self-adhesive resin cement. You can use something like Pink Reliax, your traditional luting cement. And what you'll find is once you've really honed your skills, this try-in should be quick. In this case, with Sarah, it was 3 minutes to seat this crown. You barely ever, if any, do I have to go and adjust the crown. My goal is to scan everything, mill it, manufacture it, place it without having to do any adjustments, right? That's the goal. And that's how you're able to do this in under an hour. The technology's gotten so precise that very rare, if ever, do I ever have to adjust interproximal context or the occlusion. And that's why a crown seat like this can take only 3 minutes. And here's the final bite wing, her final picture. She did want to go a little lighter, but here you have a full coverage zirconia crown, permanently cemented in under an hour. That is what you can do with today's digital technology, and it will totally transform your practice like it did mine and make you productive and happy. And so thank you for your time today, and we look forward to sharing more case bites with you. Find me on Instagram, message me if you have any questions. Thank you.